Welcome on this wonderful Friday afternoon to Ask Dr. Geier Live. Wherever you're watching, hope you're making today your masterpiece. I'm Dr. David Geier, double board certified orthopedic surgeon, sports medicine specialist, and media medical expert. I help you feel and perform your best regardless of age, injuries, or medical conditions. It is that time. I'm going to answer your questions, whether it's health and wellness or more likely orthopedic questions, injury questions, surgery questions, recovery questions. Remember, I am not giving you specific medical advice. This is meant for general information and education because I haven't seen you, I haven't examined you, I haven't looked at x-rays, MRIs, any of that. So I'll do the best to explain what those injuries are, but I am not telling you what to do. But you can take it to a doctor wherever you are, take that information and make the best decision for you. Or you can come see me as a patient here in Charleston, South Carolina. There's a link to the description below this video, drdavidgeier.com. If you go to the upper right corner of the homepage, there's a drop-down menu under Work With Me. Gets to a contact page that you can send a message to me and my assistant, and we help figure out how you can get here to see me as a patient. But I am not here to promote my practice. I am here to help you. This is the only place I answer questions, the only time I answer questions, my 30 minutes or so a week that I devote towards helping you. So answer those. I'll stay as long as there are questions, or we will have a very, very, very short chat. So leave your comments. This is only on YouTube, not like Better Than Ever Live, which is on Tuesday and Thursday afternoons at 5, which is also Facebook and LinkedIn. This is just YouTube. There's no podcast version. Leave your questions, your comments, whatever they are, in the chat, not the comments. I can't see the comments, so leave those in the chat. All right. What is everybody up to this weekend? It's beginning of May here, spring weather. It's beautifully sunny. What's the temperature? 84 degrees here in Charleston, perfectly sunny. It is a really, really nice day. All right. Fortunately, got somebody. Jerry, you may be my only question today. Jerry says, MRI, mild degree of fraying. I assume that's degree of fraying. Anterior superior labrum. Very common for older athletes. Would PRP injections be a good place to start over arthroscopic surgery to address this, or arthroscopic surgery? All right, first thing. Actually, not a first thing. A lot of things about that. Let me get my... This isn't going to show it very well because I can't take, unlike my knee, which I can open up, I can't really take my shoulder model apart. But the labrum is the cartilage bumper along the socket in the shoulder. And it deepens the socket to provide a degree of stability, but it's also a shock absorber for wear and tear. So yes, it is very common for that labrum, that cartilage bumper, to get frayed over time. One of the things that we've learned over the last 7 to 10 years with labral tears of the shoulder is that a lot of times people can get better without surgery. And is that because the labrum actually isn't the source of pain and it's more rotator cuff impingement, that type of pain? Or is it that, there are some rehab treatments that you can do to take pressure off that labrum and make it better? After all, the shoulder is not a weight-bearing joint, unlike the knee or the hip. Labral tear of the hip, good example, where you're putting weight on it, that might be much more problematic. This is my personal opinion, and I think a lot of orthopedic surgeons and sports medicine specialists, so this may not be what you'd get if you go to a surgeon. You've heard me on both Ask Dr. Geier Live and Better Than Ever Live say that more and more surgeons are pushing patients to surgery earlier and earlier. Is that because that's where they make their money? There's a lot of theories behind that, but it seems like surgeries are going way up and options that are given to patients are going way down. So is it that? But most sports medicine surgeons that are sort of playing it by the book, you don't start, especially for a degenerative labral tear, with surgery. You try physical therapy. You try activity modification short-term until the pain gets better. Sport-specific rehab if it's a specific athletic motion or exercise motion that causes it to hurt. Some people do cortisone shots. I've not found that to be terribly effective for labral tears. And there's some concern that cortisone shots in the shoulder might actually weaken the rotator cuff tendons, making them more likely to tear down the road. Not a big fan for cortisone injections for a labral tear. But yes, I do think PRP is a potential treatment. Now, what we don't know about PRP hasn't been studied as much for labral tears as it has for, say, cartilage damage in the knee leading to or essentially early arthritis. But I would say it's reasonable to try. Insurance doesn't pay for it, so you're paying cash. But really the biggest risk you run is that it just doesn't work, plus whatever you pay to get it done. But is it helping from an anti-inflammatory standpoint? Is it helping to stabilize the labrum? I absolutely am a big fan. I've used PRP a lot, both in my prior practices, which were more traditional orthopedic surgery, where I did a lot of surgeries. Now I'm in more of an anti-aging regenerative type practice, trying to help people recover without surgery. So I probably do more PRP for labral tears than I did, and I think it can be very effective. If nothing works, not just the PRP, but the physical therapy, all sorts of things that you try, and there's some medical treatments and supplements, a lot of different things we could talk about. Then you could always go back and do surgery. But just fraying, going in and with a scope and sort of smoothing out the labrum, my experience is that's been sort of a short-term benefit. That labrum is never normal like it was in your teenage years and 20-year age. And he says in the labrums. All right, so are in the hip. So take everything I just said and change it to a weight-bearing joint and say that for a degenerative labral tear, I might still try non-operative treatment. PRP is an option, but it's much harder to get in the joint. You typically need fluoro or something like that, ultrasound, but it can be done. Not as many surgeons do PRP for the hip, but it could be tried. And then it's probably a little bit more likely to need surgery. But even then, a degenerative labral tear, there's some debate about how effective arthroscopic surgery and cleanup is. Now, if it's detached, that's a whole other discussion, but surgery is certainly an option. I don't know that it's necessarily your first option. All right, Jake says, Leeds fan. Yeah, actually, I don't have a problem with Leeds. As long as you're not a United fan, I'm a pretty happy person. If you're just watching this for a first time. And actually, I just had a Liverpool shirt on all morning, and I just took it off to put this on for the show. I'm a big Liverpool fan. I have actually no issue with Leeds. Is it true if your lateral meniscus is cleaned out can lead to arthritis when 5 years? Does it depend on how much is taken away? That is a fantastic question, and there's sort of multiple things to think about with that question. First of all, the lateral meniscus is, so this is a right knee if you're looking at it. The outside of the knee has the fibula if you're not real familiar with anatomy. So the lateral meniscus is the side on the farthest from the midline of your body, the outside, so to speak. And so it's the meniscus on the outside of your knee. Statistically and biomechanically, the lateral meniscus bears much more of the weight going through your knee than the medial meniscus. It's roughly 70% for the lateral meniscus, 50% for the medial meniscus on the inside. The cartilage bears more weight and the bone and that kind of thing. So if you, just all things being equal, you take out let's just say the same percentage of meniscus from the medial meniscus or the lateral meniscus, long-term taking lateral meniscus tissue out is going to be more likely to lead to arthritis. That's just statistically. Not that either of them are necessarily good. Now, as far as does it matter if how much is taken out? Yes, it does. The more you take out, the higher the chance that it leads to arthritis down the road. But there's a caveat to that. You and the surgeon don't really have much say in how much is taken out. You take as little as you can, but you take as much of it as torn so you don't leave a little continued part of the tear that after surgery it continues to propagate and makes a new tear that you have to go in again. And that how much you take out is based on how big the tear is, and you have no control over that. So that is a function a little bit of biomechanics and the nature of the injury, how your age and how brittle the meniscus is, but then also luck, quite honestly. So that's where if it is repairable, that's absolutely what you want to do, both medial or lateral meniscus tear, but you don't have a choice with that either. Again, that comes largely down to how it's torn, the orientation of the tear. And so typically the repairable menisci are teenagers, 20-ish year olds. Sometimes you see them in older adults, but not nearly as often. But again, yes, it can lead to arthritis. I don't know about 5 years, unless a whole lot's taken out. I'd typically say more like 10, 15, 20 years, but it certainly can happen. All right, we're going to have a really, really short day today. Thank you so much, Jake and Jerry. I hope that was helpful. If you have other questions in the coming Fridays, definitely reach back out to me. If you know people that have orthopedic injuries and are kind of confused about what to do, bring them this way. Have them subscribe to my YouTube channel, youtube.com/Dr. David Geier. And I do this every Friday, 12 p.m. Eastern Time. Also, make sure to check out Better Than Ever Live every Tuesday and Thursday, 5 p.m. Eastern Time. It's not about this type of thing. We talk about health, wellness, aging, exercise, nutrition, sleep, mental health, all kinds of things to help you feel and perform your best, regardless of age, injury, or medical history. Thank you so much, Jake. You're so welcome. I will see you all right back here next Friday, or if you join us for Better Than Ever Live, I'll see you Tuesday, Thursday. Actually, there's no show Tuesday, so I'll see you Thursday. Very, very excited, thankful that you came, and I will see you. And Robert, it's good to see you. Hello. I will see you right here next week. Have a great time.